Well, the nurses group has been fighting for this legislation for years, and they say we should all care about the outcome of the pending vote on the bill. A study by Johns Hopkins in May of 2016 concluded that preventable medical mistakes could be the third leading cause of death in this country. But nurses and hospitals cannot agree on whether the overtime bill could change that or whether nurses in Ohio need legal protection against forced overtime.
So as an employee, when you're told to do something by your employer, if you don't do it, you're either insubordinate or there could be license infractions if they're turned into the Board of Nursing.
It was introduced as being a solution to a problem whereby a nurse may be terminated if he or she refused to stay after a shift that they've already worked when only informed that day. We're not aware of any such circumstances.
Nurses say, though, there is an implied threat of disciplinary action. Hospitals say they must have the flexibility to staff up.
We don't know how many patients will arrive in the emergency department within the next hour. We might have some historical data that guides us, but we don't know if it will be 3 patients or 30 patients.
Nurses routinely work 12-hour shifts, say 7 at night until 7 in the morning. Mandatory overtime adds 4 hours.
So it not only affects the shift where they're working long hours, but they're coming back exhausted for their shift that follows, and oftentimes being asked to stay overtime again.
Should patients be worried?
Absolutely.
Cincinnati nurse Beth Jasper fell asleep at the wheel, crashed, and died after working several 16-hour days in a row.
In fact, during her last shift, she had a conversation on the phone with her husband and told him, they're working me to death.
We share the concern for preventing any type of fatigue of healthcare worker.
But hospitals say outlawing mandatory overtime is not the answer. They don't want to work nurses to exhaustion, but they have to adequately staff specialized areas like obstetrics and mental health. Both sides say their top priority is patient safety, and patients know when nurses are overworked.
I think, wait a second. You got here at 7 in the morning, it's 10 at night, you're still here, when do you get to go home? I've had patients ask me that as a nurse several times, and it's uncomfortable to answer.
The bill would give nurses the ability to self-assess and decide for themselves if they're just too exhausted to safely work overtime. There are 200,000 registered nurses in the state of Ohio.